today?
Good, how are you?
Good, my name's Alexa and I'll be your student nurse for today.
Okay.
I'm going to be doing a head-to-toe assessment on you. I'm just going to close the curtain for privacy, do some hand hygiene. Can I please check your name and date of birth?
Sure.
Can you tell me your name and date of birth?
My name is Kim Zuyken and my birthday is 10/30/97.
Okay, awesome. Alright, so we're just going to be doing the full head-to-toe assessment.
Okay.
It's going to be really quick. It's going to take about 15 minutes or so.
Okay.
Do you have any questions before we start?
No.
Okay, so the bed is in a good position. Do you need any toileting?
No, I'm good.
Okay. And this is down, but I am going to leave it down because I want to access you from this side. So what I'm going to start by doing is taking your vitals, okay?
Okay.
So I'm going to start with the pulse ox.
Okay.
And can I have your left hand and your
Sure.
left pointer finger?
Here you go.
Thank you. Ooh. Stick it in there. Thank you very much. Okay. And now I'm going to take your blood pressure. Can I have your arm, please?
Sure.
So I'm just going to put that on there. Check this. Okay. Okay, good. So your blood pressure was 120/75, which is pretty normal. Sorry. Thank you very much. Okay, so now I'm going to take your temperature. Okay, so what I'm going to have you do is put this under your tongue. Okay? You just squeeze real tight, don't talk or smile or anything. Okay, so 98.6 is normal, so that's
Okay.
very good. Okay, so I'm going to take this off of you. And I'm going to take your pulse. So can I have your wrist, please? Thank you very much.
Sure.
Okay, good. So your pulse was 88, which is very normal, and your respiratory rate was 15, which is also very normal. So that's
Okay.
really good. So do you have any pain today?
I do.
You do? And where's
Yeah.
the pain located?
Oh, it's on my head.
Your head? Okay. And
Yeah.
like in the temporal
On
area?
these sides, yeah.
Okay. So when did you first notice the pain?
Yesterday.
Yesterday? What were you doing when you noticed it?
It was right after dinner.
Okay, so you've had
Yeah.
the headache since yesterday?
Yeah.
Okay. Does anything make it worse?
The bright lights, I think that's what it was.
Makes it worse? I mean, like,
Yeah.
on a scale of 0 to 10, how bad would you say your pain is?
About like a 5.
A 5? So it's like 0 being no pain, 10 being the most pain, it's about a 5.
Yeah, about a 5.
Okay, good. And what makes it better?
I mean, going to sleep helps, so I guess in
Sleeping?
the dark, yeah.
Okay, alright, good. So next thing I'm going to do is I'm going to assess your appearance. So you're a 20-year-old female. You look clean, you have good hygiene. How's your nutrition? Do you eat well? Do you
Yeah.
exercise?
I try
Like
to.
every day?
Yeah.
Yeah, okay.
Yeah.
And do you need any hearing aids or hearing assisted devices?
No.
Okay, your speech is good. Your normal. Your skin looks good. Your posture looks good. Your mood looks good. So awesome. Okay, so now what we're gonna do is I'm going to start with neuro. So I'm going to ask you a couple questions, okay?
Okay.
So do you know what today is?
Today is the 26th.
The 26th, and do you know what day it is?
It's Friday.
It's Friday? Okay, and do you know where you are right now?
I'm in the hospital.
You're in the hospital. Okay, good.
Yeah.
So you're awake, alert, and oriented. So the next thing I'm going to have you do is I'm going to have you close your eyes, okay?
Okay.
And I want you to give me your hand,
Okay.
and I'm going to put something in your hand. I want you to tell me what it is, okay?
Okay. Like a coin?
It's a point. Very good.
Okay.
Okay, awesome. So now I'm going to draw a figure in your palm.
Okay.
Please don't open your eyes, and I want you to tell me what it is, okay?
Okay.
I'm going to draw a number.
Okay. That's an 8.
Yes.
Okay.
And so now I'm going to draw a letter in this hand.
Okay. C.
Very good. Awesome. Okay, so now what I want you to do is I want you to open your eyes, and laying in bed, I want you to take your heel and bring it up to your shin. Bring it up to your chin, and then do the other side. Okay, very good. Now what I want you to do is touch your nose, and I'm going to put my finger here, and I want you to touch my finger.
Okay.
And then I'm going to have you touch your nose again,
Okay.
and I'm going to move my finger. And I'm going to
Okay.
keep doing this, and I want you to just keep touching your nose and touching my finger, okay?
Okay.
Okay, so ready? Go. Okay, very good. So now what I want you to do is stand up,
Okay.
and I'm going to stand in front of you,
Okay.
and I want you to close your eyes, and I'm going to let go, and I just want you to stand. Okay, good. So there's no swaying. Patient's doing very well. So can you sit back down for me?
Sure.
And now what I want you to do is put your hands like this.
Okay.
Take your palms,
Okay.
tap your thighs,
Okay.
and then flip it over. And then I
Okay.
want you to keep doing this, and then go faster, faster. Okay, very good, awesome. So now what I'm going to do is I'm going to take your patellar reflex.
Okay.
So I just want you to stay here. Okay, good. Good. Okay, awesome. So now you can lay back down.
Okay.
And what I'm going to do is assess your skin. So I want to take a look at your hand for a second. I'm going to do Turgor. So it snaps right back, so that means you have good hydration, which is very good. Do you have any rashes or skin lesions anywhere?
No.
Okay. Are you itchy anywhere?
No.
Okay, good. So your skin looks intact. It's dry. Your temperature is like warm but normal. And so now I'm going to palpate your head, okay?
Okay.
So I'm feeling for any lumps, any concave skull areas, just anything that like is wrong.
Okay.
Perfect. So now I'm going to palpate your sinuses. Do you have any pressure or any pain?
No.
No? Okay. All right, good. So now what I'm going to do is I'm going to do your temporal mandibular joint.
Okay.
So what I want you to do is open and close your mouth like that. Okay, so there is slight clicking. Do you have any pain?
No. No
No?
pain.
No pain? Okay.
Yeah.
So next what I'm going to do is I'm going to palpate your lymph nodes. So I'm going to
Okay.
do preauricular, postauricular, superficial cervical, deep cervical, occipital. Then I'm going to do posterior cervical, supraclavicular. Okay? So everything feels good. You don't have any lumps or hard masses. So the next thing I'm going to do is check your cranial nerve. So what I want you to do is close your eyes.
Okay.
Okay, so I'm going to take something and I'm just going to lightly tap your face, okay? And I want you to say now when you feel it.
Okay.
Okay?
Mhm. No. No. No.
Okay, good.
No. No. No.
Okay, good. Awesome. So that was cranial nerve 5 that I'm testing. So now what I want you to do is clench your jaw.
Okay.
And I'm just going to feel this. Feel your temporals. Good. Okay, so now what I want you to do is resist my pushing down on your jaw. So don't open your jaw.
Okay.
Very good. Awesome. Okay. So next what I'm going to have you do is I'm going to have you smile. Now I want you to frown. I want you to pucker your lips. I want you to grin your teeth. And then I want you to puff your cheeks. Okay? Good. The air goes out bilaterally on both sides. So now what I'm going to do is your eyes. So the general appearance of your eyes is good. You don't have any crusts, any droopiness, any excess moisture. There's no redness in your sclera, which is awesome. So I'm going to look at your pupils, okay?
Okay.
Okay. Good. Awesome. Okay, cool. So your pupils are round, they're equal, they react to light, and they accommodate. Well, I don't know if they accommodate, so let's see. Okay, so can you stare at this, right?
Sure.
And look straight forward, don't move your head, just move your eyes, okay?
Okay.
Okay, perfect. So they do accommodate. So now what I'm going to do is test your 6 cardinal fields of gaze.
Okay.
So what I want you to do is the same thing. Just stare at the tip of my pen.
Okay.
Don't move your head, just move your eyes, okay?
Okay.
This is 6, 6, 4, 4. Once again, we're just doing a combination one more time. Awesome. Okay, perfect. So now what I want you to do is I want you to stand up, and we're going to do the smell and eye chart.
Okay.
Okay, so this is just going to assess your vision. So I want you to stand at this line right here, right
Okay.
back here. Okay? And now what I need you to do is cover one eye, okay? And I want you to read the smallest line that you can.
Okay. D-E-F-P-O-T-E-C.
Okay, very good. Now switch hands.
Okay.
Cover the other eye.
So it's again D-E-F-P-O-T-E-C.
Okay, and now take both your hands down and read me the smallest line that you can with both eyes.
It's gonna be D-E-F-P-O-T-E-C.
Okay, perfect. So that means that you can see from 20 feet what normal people can see at 20 feet. So
Oh,
you have 20/20 vision. So now can you please come over here and stand here?
Sure.
And I'm going to have you face me this way and back up a little bit. Okay, very good. And so now I want you to cover your right eye.
Okay.
Now I'm going to cover my left eye.
Okay.
And I'm going to bring my finger in, and when you see it in your peripheral vision, I want you to say now, but I want you to just stare at my eye, okay?
Okay. Now. 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 No.
Okay, very good. So now we're going to switch eyes.
Okay.
And we do the same thing on this side, so just keep looking at my eye, okay?
Now. No. No. No.
Okay, very good. Awesome. So you can sit back down.
Okay.
Okay. So you can lay down. Okay. So now I'm going to inspect your ears. Okay, good. So I'm going to pull up and back on the pinna. Okay, good. You have a pearly gray tympanic membrane. You have no white, no scarring, which is very good. And this side. Okay, good. You also have a pearly tympanic membrane on that side. There's no white, no scarring. So now what I'm going to do is I'm going to take this and I'm going to bang it on my wrist and I'm going to hold it on my head, and I just want you to tell me if you can hear it equally on both sides and feel it, okay?
Okay.
Can you feel it equally on both sides?
Yeah.
Okay. Can you hear it here?
Yes.
You hear it here?
Yes.
Okay, perfect. So what I'm going to do is bang it here. And I'm going to hold it here, and I just want you to tell me when you don't hear it anymore, okay?
Okay.
Or don't feel it anymore.
Okay. Yep.
Do you hear it now? Yeah, okay, good. Okay. Ooh. Okay, tell me when you don't feel it anymore.
Okay.
Do you hear it now?
Oh yeah.
Okay, awesome. So now what I'm going to do is I'm going to have you sit up just slightly.
Okay.
Here, I can lift the bed for you if you would like me to.
Thank you.
You're welcome. And what I want you to do is plug one side of your ear by holding in the tragus.
Okay.
Okay, and I'm going to whisper things to you, and I want you to tell me what they are, okay?
Okay. C75.
Very good, and I'm going to go on the other side, okay?
Okay. That's B810.
Very good. Okay, that's perfect. All right, so now what I'm going to do is I'm going to assess your nose, okay? So
Okay.
I'm just going to hold one side, and I just want you to sniff. So take a really big sniff in, okay? Very good. And the other side. Very good, okay? So now what I want you to do, you can lean back, okay? You can close your eyes,
Okay.
and I want you to plug one side of your nose,
Okay.
and I want you to tell me what you smell when I hold it up to you, okay?
Okay.
So tell me what you smell.
Oh, coffee.
Okay, now can you plug the other side?
Sure.
Can you smell the other side?
Yep. Coffee.
Coffee, okay, very
Yeah.
good. Awesome. Okay, so now I'm just going to take the pen light and I'm just going to look in your nares, okay, to see if you have any deviation or any issues. No, you look good. When I was asking you to sniff, that was just testing the patency of your nostrils, and you don't have any congestion right now, which is good. So now what I'm going to do is your mouth. So I want you to open your mouth, and I want you to say ah. Okay, very good. So I think your right tonsil might be a little inflamed. Is that true? Do you know? Maybe.
Maybe,
Okay.
yeah, that might
Alright.
be.
It just looks a little inflamed, but it's not like anything bad.
It's allergy
Um,
season.
Yeah, yeah, true. Okay, so I want you to stick your tongue out again. So your tongue is midline. It's very good. And your uvula did move when you said ah. Now can you move your tongue to the left and the right? Okay, very good. And now I just want you to swallow for me. Very good. Okay. So now what I'm going to do is I'm going to palpate your thyroid, and I'm just going to push it to the one side, palpate the other, and push it to the other side, palpate it.
Okay.
And your trachea is midline. I assessed your swallow, so can you just sit up a little bit for me?
Sure.
Okay, so what I'm going to do is I'm going to find your... Okay, very good. I'm going to push it to one side, I'm going to palpate it. And palpate it. Okay, good. I don't feel any hard masses or any lumps or anything like that. And I already palpated the lymph nodes in that area. So now what I'm going to do... Did I palpate your lymph nodes?
Mm-hmm.
Okay. So now what I'm going to do is I'm going to move on to your cardiac cycle. So
Okay.
I want you to turn your head to the left
Okay.
as far as you can. And I'm just going to look at your jugular vein. You don't have any distension or any pulsating. And I want you to look this way. And same thing on this side. No distension or pulsating. So I'm just going to listen to your heart, okay?
Okay.
Okay. So I'm listening to the aortic. And S1 and S2 is present. Now the pulmonic. S1 and S2 is present. Now Erb's point. S1 and S2 is present. Now the tricuspid. S1 and S2 is present. Now the mitral. S1 and S2 is present. Okay, very good. I'm also going to listen with the bell.
Okay.
Okay. So the aortic. S1 and S2. Pulmonic. S1 and S2. Erb's point. S1 and S2. Tricuspid. S1 and S2, and then mitral. Okay, S1 and S2. And I didn't hear any murmurs or any bruits or weird noises, so that's good. I'm also going to auscultate your carotid, okay?
Okay.
Okay, this side. Okay. Okay, on this side. Okay. And so S1 is best heard at the apex, and it's the mitral and tricuspid valves closing, and S2 is best heard at the base, and it's the aortic and pulmonic valves closing.
Oh.
Okay. So now what I'm going to do is take your pulse, okay?
Okay.
And so I'm going to take your carotid pulse. I'm just going to feel here. Okay, good. +2. 2 plus. Take your brachial. Okay, good. 2 plus. Okay, 2 plus. Your radial. Thank you. Okay, 2 plus. Okay, 2 plus. Then take your femoral. Okay, 2 plus. Take your popliteal. Okay, 2 plus. Now the other side. Okay, 2 plus. Now I'm going to do your dorsalis pedis. Okay, 2 plus. The other side, 2 plus. I'm going to do the posterior tibialis. 2 plus, and on this side, 2 plus. Okay, so very good. So now I'm going to do your capillary refill. So can I have your hands, please? So what I'm going to do is okay. So less than 2 seconds for each finger. That's good. Okay, very good. Awesome. So now what I'm going to do is lay you down and I'm going to palpate your point of maximal impulse, okay?
Okay.
And while I have you down there, I'm just also going to take the pulse of your nipple.
Okay.
gonna palpate your PMI. Okay, good, so I don't feel any pulsating, anything like that. So then I'm just gonna try and take your apical pulse. Okay, 2+. Alright, awesome. So I'm gonna sit you back up, okay? Okay, awesome. So now what I'm going to do is I'm going to inspect the contour of your respiratory system.
Okay.
So your chest looks good. There's no cyanosis. You don't look like you're having trouble breathing. You look like posture's good. So what I want you to do is I want you to swing your legs over this way.
Okay.
And sit up for me. And I'm just going to make sure that your lungs expand symmetrically. So I'm going to lift up your shirt. Yes, please.
Okay.
I'm going to pinch a flap of skin, and I want you to take a big deep breath, okay? Very good. Okay, so your lungs expanded symmetrically. So now what I want you to do is when you feel the tips of my fingers, I want you to say 99, okay?
Okay. 99, 99, 99, 99, 99, 99, 99.
Okay, very good. So I was assessing for tactile fremitus, which is present, which is a good thing. So now what I want you to do is I want you to stay leaning forward.
Okay.
And I'm just going to listen to your breath sounds on the front, okay?
Okay.
Okay, so take a big deep breath. And deep breath. Deep breath. Okay, deep breath. And another deep breath. And another deep breath. Okay, very good. So now I'm going to do it on the back. Okay. So, big deep breath. And 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 deep breath. Deep breath. Deep breath. And deep breath. And deep breath. Okay. So I was listening to your vesicular sounds down here. I'm just going to listen to your bronchovesicular. Okay, so deep breath. Deep breath. Deep breath. One more time. Just kidding, one last time. Okay, very good. So now you can sit down. And I'm just going to listen to one more thing, okay? I'm going to listen to your bronchial sounds.
Okay.
So just take a deep breath. Deep breath. Deep breath. And deep breath. And one time. Okay, very good. So I listened to your bronchiovesicular on the back, your vesicular, and your bronchial areas, okay?
Okay.
So now what I'm going to do is I'm going to make sure that I made sure that the right rhythm and quality was good. So when I was listening to your lungs, I didn't hear any wheezing, any crackling, anything like that. Your rate was within normal range. It was 12 to 20, and the rhythm was good.
Okay.
It was normal. Okay. So now what I'm going to do is I'm going to lay you back down, all right? And
Okay.
I'm going to inspect the contour of your abdomen, okay?
Okay.
Whoa! Okay. So do you mind if I lift up your shirt?
Oh, sure.
Okay. So I'm just going to inspect the contour of your abdomen. So everything is flat. There's no distension, no umbilicus, which is good. So now I'm just going to listen to your bowel sounds.
Okay.
And I'm going to start in your right lower quadrant. Okay. And I'm going to work my way around.
Okay.
Just going to start in your right lower quadrant. good. So your bowels are normal active.
Okay.
So what I'm gonna do is, which is a good thing by the way, it means that your bowels are normal and everything's functioning regularly.
Okay.
So now what I'm going to do is I'm going to percuss each abdomen or each section of your abdomen. So I'm gonna
Okay.
start in your right lower quadrant again. Okay, I'm gonna go here. Okay, that was your right upper quadrant. I'm gonna go to your left upper quadrant. Okay. Okay, now I'm gonna go to your left lower quadrant. Okay, good. So now what I'm gonna do is, everything sounded tympanic by the way, there was no dullness, maybe a little bit over like the liver area, but nothing too bad. So now what I'm going to do is lightly palpate your right lower quadrant, okay?
Okay.
So just tell me if you have any tenderness, any sensitivity, anything like that when I'm doing this, okay?
Okay.
Right lower quadrant. Okay. Left upper quadrant.
Okay.
Left lower quadrant. Okay. So now I'm just gonna push a little deeper, okay? Did you have any tenderness or sensitivity?
No.
Good. Okay. So now what I'm going to do is by manually palpate your
Okay.
your liver. So I'm just gonna try and feel it. Okay, good. So I could just feel the edge of your liver, but it's not enlarged or anything. It feels good.
Okay.
Okay, so now what I'm going to have you do, sorry, I'm going to sit you up, okay?
Okay.
Find nothing. Okay, so I'm gonna have you stand up for me.
Okay.
And what I want you to do is stand on this line, right?
Okay.
And I want you to walk heel to toe in a straight line on that line, okay?
Okay.
Okay, very good. All right, now I want you to turn around and I want you to come back on your tippy toes.
Okay.
Very good. And then can you walk back on your heels? Okay, very good. So now what I want you to do is come to me.
Okay.
And I want you to back up a little bit so I don't hit you. Oh, actually, we'll switch. So you stand here, right?
Okay.
And what I want you to do is swing your arms forward, chest to range of motion. Very good. Okay, great. Now I want you to swing your arms backwards. Very good. Okay, now I want you to rotate your head like this. Okay, very good. Now I want you to go back the other way. Okay, awesome. And now what I want you to do is flex your leg. Very good. And extend it. And then flex your leg. And extend it. So now what I'm going to do is I'm going to push down on your shoulders and I want you to resist by like bringing them up, okay? So I'm going to push down. Very good. Awesome. So now I want you to lift out your arms.
Okay.
And I'm going to push down and I want you to resist too.
Okay.
Okay, awesome. So now what I want you to do is bend over and touch your toes. And I'm going to assess your spine. Okay, so your spine looks aligned, everything looks good, there's no S shape or abnormal curvature.
Okay.
And so, now what I want you to do is sit back in the bed.
Okay.
And what I'm going to have you do is push down on my feet like you're pushing on a gas pedal. Okay, awesome. Now I want you to flex your feet. Okay, great. And I also want you to squeeze my fingers as hard as you possibly can. Okay, very good. Do you have any questions for me or anything else for me today?
No.
Okay, so I just want to tell you that your results look really good. You don't need any assistive devices or any help. Everything seems normal and you seem pretty healthy. So thank you very much for today. And I will see you later.
Thank you.
Bye.
Have a good day.
Thanks, you too.